Hello and welcome to medicinal chemistry classes. Today we will discuss about oral contraceptive drugs. Okay. So what is oral contraceptive drug? So oral contraceptive drug is a medication taken by mouth to prevent the unwanted pregnancy or to regulate the menstrual cycle. This drug is also called as birth control pills. Okay. So oral contraceptive is used to control unwanted pregnancy. There are two types of oral contraceptive. First is your combined oral contraceptive and next is your progestin only contraceptive. So in combined oral contraceptive, the combination of estrogen and progestin is used, but in progestin only contraceptive, this type of contraceptive, only the progestin is used but not estrogen is used. So there are two types of oral contraceptive. So the oral contraceptive generally used to prevent the population or to control the population. The population control via the contraception is currently an issue worldwide. The preventing unintentional pregnancy is an important purpose of the contraceptive use, mainly in countries where population control is a goal. So the combination hormonal contraceptive includes such as estrogen and your progesterone. So estrogen, that is prevent the development of central follicle by the inhibiting the follicle stimulating hormone, and the progestin help to prevent the ovulation by suppressing luteinizing hormone secretion. So what is mechanism of oral contraceptive? The secretion of follicle stimulating hormone is prevented by estrogen, and thus the suppresses development of ovarian follicle. Then the progesterone inhibit the secretion of luteinizing hormones and prevent the ovulation. The progestin cause thickening of cervical mucus, thereby the less suitable for the passage of sperm. And the combination of both estrogen and progesterone work by the preventing ovulation by suppressing secretion of gonadotropin through negative feedback inhibition. So that is your mechanism of action of oral contraceptive. Next drug which is used as an oral contraceptive, the first drug is your Mifepristone. So this is the structure of your Mifepristone. The properties of Mifepristone is white or almost white hygroscopic crystalline powder. It is soluble in water or slightly soluble in anhydrous alcohol. The pH of 0.5% solution is 4.4 to 5.2. It is stored in airtight container and protect from light. Next is mechanism of action of Mifepristone. So Mifepristone is a glucocorticoid and progestational antagonist. It helps in the termination of pregnancy by the inhibitory activity on progesterone. The Mifepristone couple complex and decrease the rate of gonadotropic releasing hormone from the hypothalamus. Now the pregnancy prevented after ovulation inhibition due to decreased rate of luteinizing hormone required amount. Next is clinical uses. It is steroid derivative from norgestrel that has potent anti-progestogenic activity. It is used in the termination of pregnancy for the medical purpose. It is also used for labor induction after the intrauterine fetal death. It is used in the postcoital contraception. It is used in the treatment of uterine fibroids. It is also used in the management of progesterone dependent neoplasm. It also has anti-glucocorticoid activity, so it has been used in the treatment of Cushing syndrome. Next drug which is used as an oral contraceptive is your Norgestrel. So this is the structure of your Norgestrel. Next is property of Norgestrel. It is a white or creamyish white, practically odorless crystalline powder. It is insoluble in waters but sparingly soluble in alcohol and freely soluble in chloroform. Next is mode of action or mechanism of action of Norgestrel. So, Norgestrel is coupled with the progesterone and estrogen receptor inside the target cell, including the female reproductive tract and mammary gland, hypothalamus and pituitary gland. Then the Norgestrel is coupled with complex and decrease the release of gonadotrophin releasing hormone from the hypothalamus and rounded the preolatory luteinizing hormone rush. Now the pregnancy prevented after the ovulation inhibition due to decrease the rate of luteinizing hormone required amount. Next is clinical uses. It is used as birth control pill. It is used in the treatment of premenstrual syndrome. It is used in the treatment of premenstrual dysphoric disorder. It is also used in the skin treatment for endometrial cancer. Next use is maintenance for menstrual cycle regulation. Next drug is your Levonorgestrel. So Levonorgestrel, it is the structure of your Levonorgestrel. Mode of action of Levonorgestrel. The action is similar to progesterone and it's twice time potent than Norgestrel. So Levonorgestrel coupled with a progesterone and estrogen receptor inside the target cell, including the female reproductive tract, mammary gland, and hypothalamus pituitary gland. The Levonorgestrel couple the complex and decrease the rate of releasing gonadotropin releasing hormone from the hypothalamus. Now the pregnancy prevented after the ovulation inhibition due to the decrease the rate of your luteinizing hormone required amount. So this is the mode of action of your Levonorgestrel. Next is property. It is a white or practically white odorless powder, practically insoluble in water but soluble in alcohol and chloroform. It is protect from light. Okay, so this is the drug which is used in oral contraceptive. Next is clinical uses of the Levonorgestrel. It is used as most potent birth control pills. It is used in the treatment for the premenstrual syndrome. It is also used for the treatment of endometrial cancer and maintenance for the menstrual cycle regulation. Okay, thank you.